How's your brushing and flossing been going at home? It's good. I brush twice a day and I floss at least once a day. Great, awesome. Before we get started on the cleaning, I'm gonna do the gingival evaluation. That way I can check the state of the gums. Okay, whatever. All right, we are all done with the gum evaluation, so let me just kind of discuss what I'm seeing. I'm sure it looks fine. So I know you said you've been brushing every day and flossing every day, but we do have some pretty serious gingivitis going on. The gums are really red and inflamed, really puffy, lots of bleeding going on, and there's still a lot of plaque that's underneath the gums and above that's causing that inflammation. Hold up, you're tripping, because there's no way. Hold on. I brush and floss every day, okay? And besides, whenever you use that little tool, whatever you're doing, you're poking my gums, so obviously they're gonna bleed. So yes, I'm using a tool that pokes underneath your gums, but I'm using very light pressure, and when I barely touch your gums, they start to gush blood, and which that means your gums are in a very unhealthy state right now. So if I were to, say, poke your arm, right? It's not going to gush blood, but say you had an open wound and then I were to mess with it and poke with it, then it would start. So that just means your gums are in an unhealthy state and we need to fix that. Wow, you're really going to sit here and blame me and tell me it's my fault that I have gingivitis? I mean, you could be brushing and flossing every day. I'm not saying that you're not, but there is a proper technique to it that honestly I didn't even know how to do until I went to hygiene school. Could I demonstrate it for you? So maybe that could help you. That might be the problem that we have. So now you're gonna sit here and tell me I'm stupid and say I don't know how to do a simple task that everyone in the world knows how to do. That is not at all what I'm saying. I'm really just trying to help. Then just do your job and clean my teeth. And a big portion of my job is patient education, not just cleaning teeth all day. But it sounds like you're not gonna listen to anything that I'm gonna recommend.